Our drug of choice is Metformin by Ariana Gonzalez.
Bonnie Morgan.
Emilio DeLuca.
Lou Moore.
Susan Vang.
Hello, I'm Metformins. Some brand names for Metformin include glucophage and glucophage extended release. The class of this drug is an anti-diabetic. The pharmacological class is a biguanide, and it's a pregnancy category B, which means that there's no proven risk in humans. And some precautions when using metformin during pregnancy are to maintain blood glucose levels as much as possible. Insulin may be a better choice in such case, and metformin has also been noted in breast milk, which poses a risk of hypoglycemia to the baby.
Metformin use. Mechanism of action is to reduce the production of glucose by the liver and increase tissue sensitivity to insulin. Therapeutic use is for the treatment of hyperglycemia in type 2 diabetics. Pair metformin with a well-balanced diet and exercise. Dosage is 500 milligrams to 2,550 milligrams per day with a meal to decrease adverse GI response. Dosage can start small and increase weekly by 500 to 850 milligrams. The route is by mouth. Frequency, take at same time daily. Extended release may be used once daily. Immediate release is twice daily, morning and evening. And you want to take metformin with meals and a full glass of water. Duration is long-term and can be a drug that is used lifelong if well tolerated.
So the pharmacodynamics of metformin is that it lowers the blood glucose levels in 3 ways. The first is by intestinal absorption of glucose being decreased. The second is the production of glucose by the liver is decreased. And the third is that it decreases insulin resistance in tissues by increasing the sensitivity of insulin receptors. The pharmacokinetics, so the absorption is that the pill is given orally twice a day with a bioavailability of about 50 to 60%, and it enters the portal vein and bloodstream following intestinal absorption. Distribution, so according to research, the organic cation transporter, OCT1, is needed for metformin uptake, and these transporters are found in a higher concentration in the liver, kidney, and small intestine. Now, metformin is not metabolized in the liver, so it does not go through the first pass effect, and it is excreted unchanged in the urine. The pharmacogenomics, however, it is still unclear how or if genetic variation plays a role in the clinical response to of metformin. Studies have shown that the mutation in the organic cation transporter run does result in changes to the pharmacokinetics and therapeutic effects of the drug.
Okay, so physiologically, metformin makes the body more sensitive to insulin by allowing sugar molecules to move from the bloodstream into the cells, which decreases the amount of sugar molecules in the bloodstream to prevent insulin resistance. Insulin resistance is when there's too much glucose in the body and the body stops responding to glucose levels. Metformin helps lower the amount of sugar absorbed in the intestines, and it also lowers the amount of sugar made by the liver. Developmentally, there are no proven risks of teratogenic or harmful effects of metformin on fetuses of pregnant women. Psychologically, individuals who take metformin are not likely to experience any psychological effects. Continued, socioeconomically, those who are minorities have lower educational status and come from low-income families are more likely to be at risk for diabetes. Therefore, patients who have these risk factors They are more likely to be taking metformin or to be prescribed metformin to help control their blood glucose levels. Culturally and spiritually, individuals with certain cultural backgrounds have different beliefs about treating diabetes. For example, the Javanese culture in Indonesia, they tend to use herbal medications to treat diabetes. They heavily emphasize the use of traditional medicine over Western medicine when treating diabetes. Therefore, it is important for healthcare workers to have cultural competency when working with culturally diverse patients.
All right, so now we're going to go over some monitoring to make sure that our patients are eligible for taking metformin. There's some initial labs that we need to take. So the most important is going to be renal function. If a patient is unable to excrete metformin in their urine, then that's going to be a problem. It's going to build up. So it is important to monitor that for the patients because that can result in lactic acidosis if we're not monitoring that. So an initial lab is going to need to be taken to make sure that they are able to do that. So it's the GFR. It's important to take for an initial lab. Patients with an eGFR below 30 milliliters per minute should not be taking metformin. And if a patient is to have an eGFR above 45 and it ever drops beneath this level, then the patient's going to have to talk to the doctor about the risk to benefit ratio. So while on metformin, there's going to be some continual labs that need to be taken. Fasting blood glucose, postprandial blood glucose, and hemoglobin A1C every 3 to 6 months. So the hemoglobin A1C is going to tell how well blood sugar is trending over time. GFR should also be monitored periodically while taking this drug to see if it drops beneath the 45 milliliters per minute range. Blood levels of B12 also need to be monitored because metformin can decrease absorption of this vitamin. And creatinine, which is an indicator of kidney function, should also be monitored. If it is at a 1.4 or greater, this drug needs to be discontinued. So patients should be educated on signs of lactic acidosis, such as muscle aches, weakness, fatigue, nausea, a fast heart rate, and shortness of breath. If they are experiencing any of these signs or symptoms, they need to seek medical help immediately.
Legal and ethical considerations. Informed consent is always paramount in the administration of any drug to a patient. Clients have a right to refuse medical treatment. Metformin is not a controlled substance and is not subjected to limitations of prescription that a controlled substance would. It is not available over the counter and is for prescription only. Metformin was approved by the Food and Drug Administration, the FDA, in 1994 for use as an anti-diabetic agent. Patients should be educated on proper administration of medication as prescribed, adverse effects to watch for, and how to mitigate or cope with uncomfortable side effects.
Here is a critique on health inequities based on age, gender, racial, and ethnic differences in response to medication administration, action, and response. So inequities based on age shows that elderly patients are more likely to develop age-related renal dysfunction, which contraindicated with metformin. Inequities based on gender, females report more GI side effects when using metformin than males. And the reason for GI intolerance is unclear and poorly understood. In continuing in critiquing health inequities based on race, less than 50% of the time, metformin does not work in African American youth. There are evidence suggesting that genes or gut bacteria influences how effective metformin works. Inequities based on ethnicity through meta-analysis of the past indicates that Asians responded better to anti-diabetic agents than non-Asians. And the reason is because BMI plays a role in better glycemic response, which Asians are shown to have lower BMI than whites.
These are references that we used. And some NCLEX questions that we came up with. So for the first one is, by what route is metformin administered to a patient? A, intramuscularly, B, intravenously, C, PO, which means by mouth, or D, subcutaneously.
The second question is, how should the drug metformin be taken? A, on empty stomach, B, with a full glass of water, C, with a meal, or D, both B and C.
Question number 3. How does metformin lower blood glucose? Select all that apply. A, decreases intestinal absorption of glucose. B, reduces the occurrence of gluconeogenesis. C, induces glucose excretion through urine. And D, increases the sensitivity of insulin receptors.
And question number 4, who should not take metformin? A, patients who are pregnant with an A1C of 8.5%. B, patients with kidney failure. C, patients who are allergic to penicillin. Or D, patients with a high BMI.
Feel free to pause the screen to think about the answers. When you're ready, the answers to the questions are 1, the answer is C, by mouth. Metformin is available in an immediate release tablet, extended release tablet, or an oral solution. 2, the answer is D. Both B and C are correct. Metformin should be taken with a full glass of water and with a meal. Number 3, the answers are A, B, and D. Glucose is not induced to be excreted through the urine. That answer is incorrect. Number 4, who should not take metformin? The answer is B. Metformin is contraindicated for patients with kidney failure.
So prior to going into our patient's room, we use the nursing process to explain metformin, starting with an assessment. So we would assess the patient for the need of metformin, and kidney function should also be assessed. And a patient should be a type 2 diabetic to be a good candidate for this drug.
Diagnose: patient is at risk for unstable blood glucose related to insulin resistance as evidenced by A1C outside of normal range.
The plan of action is to utilize metformin along with a well-balanced diet and exercise to control the blood sugar.
And we're going to implement that plan. So the patient will be given metformin and have a consult with a nutritionist to implement proper dietary guidelines that help stabilize blood sugar, and that should also help them to lose weight.
Evaluate. We'll check patients' blood sugar and A1C to see trend over months of using metformin. Evaluate patient compliance to diet and exercise program by weighing patient every 6 months. This is our developed metformin information brochure. This can help a patient bridge certain gaps in education and helps to answer questions they may have when they leave the office. It can answer a few common questions, such as a general overview of metformin and how to take it. It can answer what metformin is used for, how it works, some general side effects, and effects of consuming alcohol with metformin, which can lead to several serious side effects, and what kind of testing they may experience while they're on this drug, as well as black box warnings.